So after you complete wiping down each of the hoses, you're going to go ahead and plug them in to the appropriate area. And they're color coded. Going to wipe down the tubing. Okay. Cover it out with a bag. I'm going to go ahead and attach the nasal hood to the hoses. And after pre-selecting the correct size for the patient, one of the things you want to look at are your hoses, and one of these hoses has vacuum printed on the hose, and that's where you're going to put this piece, which looks like a V, and that's a good clue. After you open your sterile pouch, you should have 4 pieces. Okay, and here are the 4 pieces. These should be included in your sterile pouch. So go ahead and start by attaching these to the nasal hood. This goes like that, right? Is that it? I think it is. It's gotta be. And this sometimes takes a little bit of coercing to get it to fit snug. Okay, now remember our V shape, our V section here, so we're going to connect that to the vacuum hose. And then the other hose goes on the opposite side. And then you should be good to go. Okay, so now we're ready to test our equipment to make sure it works. We're going to turn it on. And we're going to turn, and so we can see the digital readout here. We're going to turn the scavenger on here by turning this little dial this little knob next to this dial, and we want that arrow to rest right between the red and the green. And as you can see, the oxygen light is flashing, and that tells you that you've got oxygen flowing. Okay, so once we've estimated her tidal volume by taking her respiration and dividing it by 2, her respiration was 14, so her tidal volume is estimated at 7. So we're going to go ahead and increase this number here. This shows you liters per minute flow, and it's 100% oxygen. So we're going to increase this to 7 by pressing the up arrow. Okay, so now we're going to go ahead and place the nasal hood on the patient, and we have oxygen flowing through this. Make sure that's flowing before you place the nasal hood. Sometimes your patient can help you adjust that for their comfort level. We're going to check for leaks of any of the gases. You can adjust this back here. If you need to fill in any gaps within where the gas may be leaking, you can take a 2x2. I'm just going to place this up here. How's that?
No, it's kind of leaking over there now.
Okay, it was okay before? Okay. How's that? Feeling like it's okay. So now what we're going to need to do is ensure that the patient can breathe normally with the oxygen flowing only before we even start titrating the nitrous oxide. So we're going to let her sit here for about a minute or so, breathing oxygen normally. While we're doing that, we're going to check that this bag is about 2/3 full. So how are you feeling? Are you feeling like you can breathe normally? Do you feel like you need more oxygen, or that you have too much air coming into your nose?
I think I could probably have a little more.
A little more? Okay. And so this is where that estimated tidal volume is just an estimate. So we're going to give her a little bit more. And again, we're going to let her sit there for about a minute or so and let her breathe normally. And it's very important to make sure that the patient is breathing normal oxygen before you begin titration. How's that feel? Does that feel normal?
No, that's okay.
Okay, and you're comfortable? Okay, so you're feeling like you're breathing normally? Okay. We're going to go ahead and begin titration now. So now that we're going to go ahead and start titration, I'm going to do that by decreasing the oxygen, and that will automatically increase the nitrous oxide. And we're going to do it in 5% increments. We're going to let her sit there for about 2 minutes for each titration so that we can assess whether or not she's feeling the effects of the nitrous. Shows your oxygen flowing, and then you're seeing your nitrous oxide flowing as well. Okay, so can you describe to me if you're feeling any different?
No, I'm not feeling any different.
Not any different? Okay, we're going to go ahead and give you some more nitrous oxide. So again, we're going to decrease that by 5. So we're now at 90% oxygen and 10% nitrous oxide. And again, we'll wait for 2 minutes. So it's been 2 minutes. And can you describe to me anything that you're feeling differently? No? Okay. So we're going to go ahead and give you a little bit more nitrous oxide. So it's been about another 2 minutes. Are you feeling any different at all?
Oh, starting to feel a little tingling in my fingers and toes. Not too much difference.
Not too much. Okay, so we're going to let you lay there for about a minute more and see if you feel any differently. Okay, so you've been on that level for about 3 minutes now. How are you feeling now? Any differently?
I'm feeling really kind of heavy and sinking into the chair.
Okay.
Really relaxed.
Okay. So it sounds like you're feeling pretty comfortable. Okay. You're breathing okay? Okay. So do you feel like you're ready to go ahead and start with the procedure now? We're going to give you some anesthetic.
Oh, yeah. That'll be fine.
Great.
Yeah.
Okay. Okay, so we went ahead and finished your procedure. You're doing okay? Okay. We're going to go ahead and start putting you back on oxygen fully. So one of the nice things about this digital readout is you can actually determine how much nitrous oxide was flowing and how much of your oxygen was flowing. And you push this button here, display nitrous flow, and you notice it's 1.1 liters per minute flow. And you hit display oxygen flow, and that's 6.2 liters per minute flow. And it adds up to 7.3, which is her total tidal volume. Go ahead and change this, so you're not going to have the nitrous oxide anymore. And we're going to have you on the oxygen for about 10 minutes, since the procedure took about 40 minutes. Okay? Okay, so we'll go ahead and let you sit there and relax, and soon you should be returning to normal. Okay, so how are you feeling? Back to normal? Okay. We're going to go ahead and take the nasal hood off. And you've been on oxygen for about 10 minutes. Okay. And so we're going to go ahead and put your chair up. And we're just going to go ahead and make sure you're back to normal. So we're going to go ahead and take your post-op vitals now.